So the procedure you're going to be undergoing is called bilateral myringotomy tube placements, or ear tubes. So the first part is, you're going to come into the facility, and then you'll register, and they'll take you back to the pre-operative area where they'll change clothes. Sometimes you'll get an IV, sometimes you won't. The anesthesiologist will take you back to the operating room, and there, when you're in there, the anesthesiologist will have you go to sleep. Once you're asleep, then I will use this microscope, okay, to look inside your ear with this. Okay. This gets me really close to the ear canal and into the area where the eardrum is. Okay. And then I make a small incision using a small blade, similar to this, on the eardrum. Once I make that incision, then I use a suction device. If there's fluid or pus or infectious material in there, I'll suck it out and clean it out. Then we'll put this tube in the eardrum. Okay. Once that's in place, then I may put some eardrops in there, and then we will put a cotton ball in there. And then after double checking, making sure there's no excessive bleeding or oozing, then the anesthesiologist will wake you up from anesthesia. You'll head to recovery, and once you're a little bit more awake, you get to go home.
Overall, this is a very well-tolerated procedure. Once you're at home, most people will expect some mild, moderate discomfort, and generally you'll take some ibuprofen or Tylenol for pain and discomfort. The other issues that you may get some drainage from the ears, which could be clear or even sometimes bloody, but that's okay. Most of the time, we'll have you treat the underlying infections with eardrops, and that can be 4 to 5 drops twice a day for about 5 to 7 days. During this time, we encourage you to call our nursing staff with any particular questions. The only real precaution that we want you to follow is not to get water directly into your ears. That can be quite painful.
Activities such as swimming should be fine in swimming pools. However, you should avoid lakes, rivers, and oceans.
Patients will sometimes ask and wonder, how long will the tube stay in the ear? Tubes will generally last anywhere from 6 months to 18 months. However, they can fall out anytime before that or stay in longer than 18 months. Sometimes we'll need to go in and remove them, particularly if there are no further infections. If they fall out early and the patient has repeat infections, then sometimes we have to put another set in. On occasion, the tubes can fall out and there can be an opening where the initial incision or cut was made to put the tube in. If that doesn't close on its own, sometimes we have to go back in and patch it or close it. And for the most part, those are the possibilities with your ear tubes. And just remember, if you get any questions at all, either before, during, or after the procedure, please call my office staff and they'll be able to answer any and all of your questions. Thank you.